This is the CJASN podcast. My name is Michelle Estrella, and I'm a nephrologist and clinical investigator from the Kidney Health Research Collaborative at the University of California, San Francisco, in San Francisco VA Healthcare System. On behalf of my co-authors, I am excited to share the results of our team's most recent project entitled Association of Kidney Function with SGLT2 Inhibitor Discontinuation Among United States Veterans, published in CJASN. Several randomized clinical trials have shown that sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors for short, reduce cardiovascular disease events and slow the progression of chronic kidney disease. Individuals with chronic kidney disease gain substantial benefit from these medications if they take them. However, a risk-treatment paradox seems to exist, where persons with chronic kidney disease are actually less likely to be prescribed cardio and kidney protective medications, and when they are prescribed, they are also less likely to remain on them despite their elevated risks. Our study evaluated whether a patient's kidney function level at the time they began taking an SGLT2 inhibitor was associated with their likelihood of discontinuing the treatment. We evaluated electronic health record data from over 220,000 patients in the Veterans Health Administration who initiated an SGLT2 inhibitor between 2017 and 2021. The majority of the patients were male, with a median age of 68. The median eGFR at baseline was 73. In general, the rate of SGLT2 inhibitor discontinuation was high. In fact, approximately 1 in 5 patients had stopped taking the medication within 1 year after starting, and this was consistent across calendar years. Among the patients who had stopped taking SGLT2 inhibitors by 1 year, 41% of the discontinuations occurred within the first 3 months. Overall, compared to individuals who had an eGFR of 60 or higher, those with lower eGFR levels were more likely to experience medication discontinuation, and that association was independent of demographic, socioeconomic, and behavioral factors, as well as comorbid conditions and other medication use. Fortunately, although this association persisted from 2017 to 2021, it did weaken over time. In summary, a substantial proportion of patients experience SGLT2 inhibitor discontinuation within a year of initiation. Persons with lower kidney function had higher discontinuation rates, but reassuringly, this trend appeared to lessen over time. As SGLT2 inhibitors are increasingly adopted, we will need additional studies to understand how we can encourage and facilitate patients staying on them, which is essential to maximizing their benefits. Thank you for listening.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.